fear and worry and concern in general population and among certain groups in particular, such as the elderly, care providers, infected people, and people with health problems. Among all the rights to which we are entitled, healthcare may be the most intersectional and crucial part. In general, health systems experience varying levels of stress in the face of increasing infection rates. As we see in the graph, the number of infected people is increasing over time. With the massive increase in demand on ventilators, related healthcare devices, and the intensive care units, the pressure on these devices has been immense. People that go through the state where using ventilators is mandatory. For example, the infected people tend to go the hospitals nearest to them without really knowing if there is free or available ventilators, causing interaction with other individuals in the process. Due to the pandemic virus, the number of these people has increased so much that the load on the intensive care units and therefore on the devices that has been substantial, which results in the picture that displays the depletion of these devices. So we address the problem and try to find a solution that help and contribute the process of managing the available resources like the hospitals and therefore the devices and the ICU units and so on. So our solution will be introduced by Belal Mohamed.
Yes, our solution for this problem is called Hospitals Around, which is an application that shortens the time needed to find the proper uncrowded hospital that matches the customer needs, thus saving several people's lives as the main problem for people with coronavirus disease. For example, that the patient can't allocate the uncrowded hospital, so Hospital Around will solve this problem. Our solution is targeting people who have an internet connection and over 14 years of age. These people would also develop or have a relative or a friend who has developed several conditions of a specific disease that requires intensive care. Our influence goal that we want to make people believe that time is always more significant than the disease itself, and the methods that save time and stop time wasting are as valuable as the actual medical cure. So saving time methods need to be invested, and that's why we need investment in Hospitals Around. Also, our solution won't only be dedicated to ICU units and coronavirus cases. Still, it divides the medical needs into categories that will make it sustainable in the future. To help people find the closest and least crowded hospital for their needs, the solution will be sustained because it will help reduce the crowds, distribute the medical capabilities in the best possible way, obtain faster medical care, and reduce the pressure on some hospitals. The application will be discussed with Ahmed Samy.
What we see right now is a demo of the app. We coded it with Flutter, and we will code the actual app with Flutter and Dart. Why we chose Flutter and Dart? Because those two languages provide the beautiful widgets that can be a beautiful experience for any Android user or iOS. Also, Flutter and Dart are one code-based languages, so the code will work on iOS and Android, so it will be actually easier for us to code an app. Also, we will use for the back end of the application, we will use Google Firebase because it's not only easier to work with, also it's more secure and safe than usual back end that we cannot code and make it secure. So we will use Firebase because it's more secure and it's more and it's free. So we'll use it. We will use Flutter and Dart, and we will use Google Firebase for the application. And this is a demo we coded so we can illustrate how the app will work for you. Okay, I guess we are finished now. You can ask questions.
You guys done?
Yeah.
Yes, we are done now.
I think judges can start asking questions if you guys have any. Are there any questions on the judge's side?
What's your desired outcome? What's your goal?
So our goal is to save time wasting that cost many people's life. So we want to reduce time that people actually need to get to in a hospital. So we will construct an app that will help people get to a hospital that has more ICU units. And we are in coronavirus disease pandemic, so ICU units are actually crucial for people's life. So we want to reduce the time needed for people to get to the ICU units. That's our goal. That's our main goal.
Yes, as I said, also stop time wasting are as valuable as the actual medical cure in some cases.
And how will you measure your success? How will you know if you've achieved your goal?
We will know if we achieved the goals that we will want to see the actual users of the app, the number of the actual users, and we want to know that the number of the people that the get their life saved by the app, or the time reduced for people that to get to their ICU units. So that's that's how we will
Thank you.
Hi, this is I have a question, and thank you for your presentation. How will you partner with hospitals to determine how many ICU beds there are available at any given time?
So the answer to this question, we actually thought about this question, and we thought that we should advertise to our app to the hospitals to get to know our application use, and we also want to talk to the around hospitals that that surrounds our homes, and that's at the start. At the at the start, we will talk to the hospitals that surrounds our homes, and then when we make a success, when we make success with our apps, we will make advertising to the all over our country.
Thank you.
Right.
Thank you, guys. Are there any other questions from the judges?
Yeah, one quick question from me. This is Madan here. So just following up on that one, do you use any backend hospital-related APIs, or are you manually figuring out like how many beds or stuff is available in each hospital?
We will use manually backend for the hospitals, as there is no hospital in Egypt that uses API that can help us developing the app. So in the first, we will manually develop our backend, because there are no hospitals that will help us in figuring how to manage APIs. And then we will actually figure out if there are any hospitals that can use API, that uses API hospitals, then we will actually use it. But for APIs, we are gonna use the Google Maps APIs because it will help the people know the routes, the fastest route to the desired hospital. So we're gonna use Google API Maps.